welcome to the pod, Dr. Osama.
Thank you.
It's a pleasure to have you on the pod, and thank you for inviting me to your amazing and beautiful office. So we're going to go ahead and dive into a little bit more about Impiricus itself as a company and your story as well, because I think your story is interesting because you went, you studied dermatology and then eventually you opened up your own business or your own startup. A lot of doctors get into medicine, either they're passionate or they're not passionate about it, and eventually either they start up their own practice or they stay in that field and maybe they don't know how to transition from that phase of life into owning a business or starting a business. So I guess let's start there. Where did you study? Where did you go to school? And then what led to you going into dermatology?
Yeah, actually it's funny because I've been starting businesses for a while. I started my first startup, started a company with some of my friends in high school that was like a record label, and then went to college, was interested in health policy, did a whole bunch of different work. So I worked with a law firm that was suing Medicare, and then I worked for this giant lobbyist organization and saw that for a lot of the changes that need to happen in healthcare, you have to have some sort of financial incentive, and technology is a really big piece of that. So my last year of college, I actually started a company that built software selling into hospital systems. Took that company, raised some money for that, and then sold that company, didn't really make any money from it, and then went on to medical school. So medicine was always something that was like interesting to me, and was like the path for me to do, in the sense that I loved being a physician, I loved the idea of medicine, but the creative side was always like starting companies. And then went to medical school, and then entering into residency, just saw a really unique opportunity that built Impiricus.
Guys, so let's rewind just a little bit.
Yeah.
And you said you started a record label. Most people don't think of starting a record label when they're young. So, like, what was the name of the record label? Who'd you start it with? Where did that?
Yeah, it was just some friends from high school, and I mean, we didn't even we had like one song that went on the radio, and then it's actually funny, like for Islamic reasons, I was like, I don't actually even want to be in this industry, so then like left, and then things kind of fell apart. But it was just some friends making some music, thinking, how do we structure this in terms of an organization, and made it into a record label, and then went from there.
MashaAllah, that's amazing. And then this company that you started in, I think it was post-high school, this other healthcare company that you started.
Yeah.
What was the name of that company?
So it was called Vitamin C. We started in Athens, Georgia. We had an office in Athens, raised some small amount of money, and sold to like the local hospital systems in Georgia.
So what did Vitamin C do? Like as a company, like what did it offer?
Yeah, so when I worked for the New York Hospital Association in New York, it was after the Affordable Care Act was passed, and my job was tasking, so there's all this money in medicine and healthcare that was directed towards keeping people healthy, and these hospitals would think about chronic condition programs and patient education programs, and a lot of those programs were like physical, like write your stuff down on a piece of paper, bring it back, and we'll look at it. And the idea behind Vitamin C was just, okay, can we take those physical things and digitize them and make it so that hospitals can do those things in a digital way. Had a lot of learnings in the sense that it sounds simple, but it's way more difficult in healthcare in terms of implementation. It's not just about the technology, it's about the politics and the other systems and how all that stuff interface. But that was the idea, was taking a lot of that physical paperwork that patients would have to do and digitizing it for the hospitals.
So why was that difficult? Was it because of HIPAA compliance regulation at the time, or is it a lot easier now if you were to start something like that today?
When you think about healthcare, the first thing I think people think about is like, oh, we should sell things to doctors' offices or we should sell things to hospitals. Those are actually like horrible buyers because they're really big political organizations in the case of a hospital with very thin margins. Like they don't have a lot of margins. They talk about innovation. They have a lot of people kind of in innovation heads there, but they just have such thin margins. It's really difficult for them to truly innovate. They also have a huge bunch of kind of policies and regulations that inhibit them from doing things. So HIPAA compliance is one of them, which is totally fine, but the amount of momentum you need to have something actually started in a hospital system is like very, very high. Like you have to integrate with a whole bunch of existing systems. There's a whole bunch of different players. There's a whole bunch of reasons why people would say no, including the fact that you're new, where even if you have the technology down, even if everything on the back end is HIPAA compliant, if you're not integrated and fully on board of kind of their 5-year vision and willing to spend 2 to 3 years getting into them and working with them, it becomes really difficult to sell into them. So that's kind of why hospitals seem like a buyer, because they seem really big, but they're actually like a horrible buyer in healthcare.
Why is the margin in a hospital so thin? Like, why would that be the case?
It's staff. they get paid based off insurance reimbursement, and there's time delays. So like, it's not like you go into a hospital, you pay X amount of dollars, and then you come out. It's all based on insurance. Insurance will negotiate with the hospitals, pushing things down. There's a lot of administration. Obviously, medicines are expensive. Sometimes they have to, pay out of pocket for certain medicines, and then a lot of hospitals end up having to provide a lot of care for free because patients are coming in and they can't afford stuff. They're not going to turn people away, and so the margins in hospitals are really low. I think a good hospital runs at like a 3 to 5% like margin, and a lot of them operate on losses.
I would have thought, like, I guess maybe because the circles of people that I'm in, I was always assumed that hospitals in general or even general practices would run at much higher margins than that.
Yeah, I mean, it's also different. Like in the 90s. Running a practice was a lot more profitable than it is now. And a hospital is very different than running a private practice. But yeah, it's gotten a lot more compressed over the years, and there's just a lot of costs associated with it, right? And so like scaling and becoming a hospital is very different than like running a private practice, and very different depending on your payer mix and the types of patients that you're seeing. But for most hospital systems, they aren't.
So when you say payer mix, what exactly does that mean, just for the audience to understand?
Yeah, so a payer mix is basically 100 people walk into the hospital. Do all 100 of those people have commercial insurance that is paying well, or maybe 50 of those people don't have any insurance, they're not going to pay anything? And so if you look at different geographies, you can see the payer mix of like, okay, this is where there's good reimbursement, this is where there's bad reimbursement. And obviously a hospital has to serve everyone, so that mix matters.
So when the Affordable Care Act was passed, did that help in any way solve that problem to a degree?
It was supposed to. So there's federal stuff on like how healthcare is paid for, like with Medicare, and the Affordable Care Act was kind of boosting up people's insurance, but also relied really heavily on expanding Medicaid programs. And certain states like Georgia didn't expand their Medicaid programs almost entirely for political reasons. And that actually had a negative effect because the federal government would pay hospitals with bad payer mixes extra money called disproportionate share payment. So basically, if you're a hospital in rural Georgia and you see a bunch of people who don't have insurance, the federal government will actually pay you to see those people, and you would get money. And then when the Affordable Care Act was passed, suddenly everyone was supposed to have Medicaid, so everyone was supposed to have insurance, which means the federal government said, we're not going to give these extra payments anymore because everyone now has Medicaid. But then states like Georgia would say, no, we're not expanding Medicaid. So now a lot of hospitals in Georgia, like Wellstar in Atlanta, closed because they had a lot of patients. Georgia decided not to expand Medicaid. They aren't getting those extra payments anymore. And then there you go. Now those hospitals can't afford to keep seeing patients. The Affordable Care Act also like put in a bunch of different, not to go into like the specifics of how healthcare is like paid for in the US, but there's a bunch of new models for payments, like value-based care programs, accountable care organizations. There's a whole bunch of like innovation money that they put into, so that changed things a lot. But definitely the biggest thing was like setting up Medicaid expansion and then setting some baselines of like what minimum coverage for insurance would be.
So then you then turn around and sell vitamin C. How much do you sell it for?
It wasn't really any money. I mean, we sold it for a couple $1,000s to one of our current customers. It was, for me, like, we spent a lot of time into it. One of the big hospital systems we were working with, like a whole bunch of people got fired there for an external reason. And it's just tough being in that market. And so I was going into medical school. I took a year off from medical school and said, all right, this business isn't working out, time to close it down. We sold it to one of our customers and then moved on.
So is it still running today, or was it absorbed into something else?
It was absorbed into something else. So that other company is still using it today, like the core pieces of it. There's been a lot of other companies that have emerged in this space as well, like Memorial Health and a bunch of other companies that have started in this space. But yeah, it's mostly, I don't even know if that company's still using the code, but it's still, that company still exists.
So after vitamin C is sold, you then jump into med school and you spend what, 3-4 years in med, and then how long is your residency?
Yeah, so it's 4 years in medical school, 4 years of residency. Yep.
And then in residency, you decide to create Impiricus.
Yeah, I mean, there was this really unique opportunity where in clinical practice, like in med school, you're always taught that pharma is the big bad guy. Never talk to a pharma company. But then in clinical practice, there's actually like a lot of reasons why you might work with a pharma company, whether it's for samples or clinical trials or patient assistance programs. And it was this big black box of like, who do I talk to and what do we do? And there was actually an existing company here that was already working on that problem. And so I partnered up with who became my co-founder of this company to kind of work on that problem together.
Got it. Okay. So then what So that was the inspiration then, basically. That's
Yeah.
because you were already funneling or focusing on this one little problem, and you found somebody else who was already in the space, basically, and you merged
Exactly.
basically your leaderships. So I guess your background in medicine didn't really influence the creation of the company itself. It was more so like you were trying to solve a problem more so than anything else. Right?
Yeah, I mean, obviously you can see it as like, since I'm a physician, it was a problem that was like affecting me directly. But there was other people working on the problem. Like I didn't create any IP for Impiricus or anything like that. And so, yeah, like the problem was a problem that I fixed in my work. But if I wasn't a physician, I probably could look at this problem too, just wouldn't have as good insights into it.
Of course, and that definitely makes sense because like if you're not in the business, it's hard to figure out what exactly does it need, what problem are you actually solving. So I completely get that. So just out of curiosity, did you face any challenges going from clinical work to jumping into a tech startup? Because you already had the, I guess, entrepreneurial spirit, so to speak, right? So was it difficult transitioning from being a physician to running a tech startup?
Yeah, I never really like transitioned in the sense that I was in residency, and this was kind of like the project I was working on. In residency, you have like a research project, and I talked with my department and everything and said, hey, my main project is going to be this company that I want to help and work with. And so that was totally fine. So I was like full-time doctor, full-time in residency, and then on the side just kind of working through this company. Once I finished residency, dermatology is unique in that you can be very part-time. So I practice 1 day a week. I still do. It's just I spend a lot more time with Impiricus in the company.
Got it. And is the reason because you actually, I guess you love working at Impiricus. You love building this company, right? So how do you, when you balance your patients and the company itself, is it so then that way you can still have that, I guess, touch point with your clients or your customers, so then that way you can better inform the end product of Impiricus? Is that the idea?
They're actually like kind of separate. Like medicine in and of itself is a really good field. Having patient interactions is really great. Like it's stimulating. I get to use my hands, I get to use my brain, things like that. So like medicine is like its own little job that I do, and the Impiricus stuff is like another different job that I do. So instead of like I'm doing one or the other, or like only one, I kind of am doing two jobs. It's just that the medicine job is only 1 day a week that I do.
Why is there so much flexibility in working with because normally hospitals or something like that, don't you have to work a certain number of days, or is it dependent on the contract? Like,
yeah, I mean, like this, and I know this from the business world. Like everything's a negotiation, right? So like I'm a dermatologist. I trained at a great place. If they want to work with me, I only work 1 day a week, and lots of people are down to do that. So.
Oh wow, okay. So I guess one of the other questions that comes into my mind is like, as a Muslim entrepreneur, does that influence the decisions you make within the company itself?
Yeah, it's a good question. Obviously, like I said, for that first company, I decided not to do a record label because of like my values as a Muslim. But I don't know if there's like anything specifically that being a Muslim changes in terms of like what we're doing at Impiricus. Obviously, like I have core values. My co-founder isn't Muslim. We've hired a lot of Muslims. We've also hired a lot of non-Muslims. So I don't think there's anything that like we fundamentally do differently that I like a good example is like I don't do anything differently as a Muslim here, like running a company, than I do as a Muslim physician or as like a Muslim normal person of the community.
And that makes sense. That makes sense because like I know for people who are like in finance, for example, there's a huge dilemma there because it's like, oh, am I dealing with interest? Am I dealing with riba versus, oh, am I dealing with equity-based deals? So debt financing versus equity financing. So there are issues there in that particular industry, whether it's accounting or finance.
That's a good question.
But like in medicine, I don't think it's inherently not problematic, right? So it doesn't really face that many issues in that sector or that issue with Islam. Other than maybe like...
I mean, I knew to know with my first company, like Vitamin C, there was definitely times where like to do a business deal, they wanted to come down and drink and all that stuff. And I don't drink. And so like, I think we've probably lost deals because of that. And I remember actually one investor, like I was in college and he was like, for you to raise money, you have to change your name and things like that. But like, that stuff doesn't really affect me. It's like kind of their problem. It's not really my problem. And like when we build Impiricus, we stick to our values. And if they don't like it, they don't like it. It's kind of their problem.
So just out of curiosity, what are the values of Impiricus?
Yeah, Impiricus, I mean, our number one value is obviously to drive like positive, patient-focused, ethical relationships between pharma companies and physicians, where we're taking all these resources and driving them over to the right doctors to help patients. From a value standpoint, we're very much a startup. We're one of the fastest growing companies in the United States right now. We don't publish our numbers, but it's very much about people who are coming in, working nights and weekends all the time, trying to solve this mission. It's people who are kind to each other in the sense that there's always things going on and we always have to communicate all the time, and it's a very small focused team solving that problem. So that's what we're doing here.
Impiricus, the problem that it solves is the healthcare pharma relationship. So if you could maybe distill in, I guess, a layman's terms, what exactly does that mean?
Yeah, so doctors obviously prescribe medicines, yes. And there's a bunch of different things when you prescribe a medicine that if you knew about them can make you more effective in prescribing a medicine. A good example is if you knew that there was a certain indication that it's for, or there's a new indication, or there's a new side effect, or there's availability of samples. So if your patient has issues, you can give them samples. Or if there's availability where if the insurance company isn't paying for it, the pharma company oftentimes will pay for the drug if you think it's good for the patient. So there's all these resources available, and our job at Impiricus is really just making sure that those resources are there for that physician and it's easy for them to understand and access them.
Hey there, listeners. I hope you're enjoying this episode of Diary of a Muslim Entrepreneur. I just want to take a quick moment to thank you for being here. Now, here's something surprising. Did you know that over 95% of the people watching or listening right now aren't actually subscribed? Isn't that so crazy? That means for every 1,000 of you who are watching this, 950 of you guys are not subscribed. Subscribing is super simple. Just hit the notification bell down below. It makes a huge difference here for the team at Dome. When you hit that subscribe button on the YouTube channel, you're helping us grow, which means we can bring in bigger and more inspiring guests, and guests who can answer some of the questions that you might actually have. It allows us to produce higher quality videos and make the show the best it can possibly be. The more support we get, the more we can give back to you with even better content. And here's something special. Once we hit 1,000 subscribers, we're doing a giveaway for a brand new set of 2nd-gen Apple AirPods Pro that are right in my hands right now. So if you want a chance to win and help us hit that milestone, make sure to subscribe to the YouTube channel, share it, engage in the comments down below, and follow us on Instagram. You'll find all the links right down in the show notes. If you're really enjoying the show, consider becoming a sponsor of the show. Your support directly helps us keep these powerful stories coming and allow you even to reach a community of like-minded Muslims and entrepreneurs. So go ahead, hit that subscribe button on YouTube, engage in the comments down below, follow us on Instagram, wherever you find your podcast, and leave us a review. And maybe you'll be the lucky winner of those AirPods Pro. Now let's get back on to the show.
Would it be like a digital portal that these physicians are accessing and finding information and data on specific drugs that would then benefit the end consumer?
Yeah, it's a great point. So our core product is kind of three main things. One is data. So we have a whole bunch of data that we've acquired, created, have a bunch of tools to do in terms of understanding who physicians are, what they care about, what prescriptions they're doing, what kind of patients they're seeing, their payer mix, things like that. The other piece is a piece in terms of actually reaching those physicians. So traditionally, pharma companies will hire reps to go and deliver lunches. And so we do a whole variety of things, from acquiring companies that do email campaigns. We've acquired companies that have bought physical mailing lists. We've hired our own reps as well that are Impiricus reps as opposed to pharma reps, and armed them with that data. And then the last piece is we do a bunch of tooling for the pharma companies. So pharma companies traditionally will have all their resources on this website that is like 10 layers down into the website is actually what you need. And we bring a lot of that stuff up front. So it's a combination of data, channels, and then making sure the resource is easily accessible, and we pull all that together that a pharma company.
So when you say
with.
Channels, what exactly do you mean by that?
Yeah, like a good example is like instead of a pharma company needing to hire a rep, they'll use a rep that Impiricus provides.
Understood. Okay. Got it. So you're basically aggregating data and making it easier for physicians to understand. Okay, that's cool. So then I believe your platform leverages AI to a degree. What exactly, or can you explain how it works in the context of like healthcare in itself?
Yeah, there's a lot of data. So like, I think we last checked, we have about 5 billion data points on physicians in the United States, and figuring out the right message to send to the right doctor or the right request that's coming into us, how do we accommodate that? used to be a very manual process. Like we develop algorithms to figure it out, and just kind of with AI, it becomes a lot easier to go through large amounts of data, customize it specific to a person, use natural language to create some sort of response to them. So that's really what we're building.
And then you mentioned just a moment ago that you actually acquired a company along the way while you're building this. So you said you acquired some companies that do like email marketing. Is that correct? So why would a business do that? And I know the reason why, but just for the audience's sake, like why would a business want to vertically integrate those pieces? Is it to market the product, or like what are the reasons behind acquiring a...
Ultimately, once again, core mission, how do you bridge between physicians and pharma companies? There's a decent number of physicians, I would say it's not everyone, but a decent number that use email as a way of them interacting and learning about new things. And so for us, it's all right, what's the best channel that's doing email best? And can we partner with them? Can we replicate it? Do we buy them? And so in some cases, we try to build it ourselves. In some cases, we partner with companies. In other cases, we buy those companies so that we can make sure it's available for our
How do you make the
physicians.
distinction between whether you want to buy them, whether you want to partner with them, maybe use an agency and learn how they do it, and then eventually integrate that into the business? How do you make that clear business decision, which route to take?
I don't know. I mean, it's a mix of a lot of things, and like the short answer is vibe. Like, is this somebody that we want to work with long term and think would benefit from? If they were within our company, would they 10x kind of the things we're doing? Is this something that we want to partner and see? Is this something we want to build? Like some things are very cheap and it's more effective, and we can use our own advantages to build something. On the other hand, sometimes things are cheap to buy. Like every deal is different.
When you're collecting all these data points, I'm guessing you're having to anonymize them to a degree due to HIPAA compliance. Is that the case, or am I mistaken?
When we do, some of our tools interact with patients, and there's definitely HIPAA compliance that goes into that. And that's like, it's not really anonymizing it because we're not selling patient data ever, but there's like policies and procedures internally of like who has access to that data and things like that. And then for the physician side of things, like, it's just dependent on the state that they're in terms of how much we need to mask their data, how much rights they have on their own data. Physicians can always come to us and say, hey, I want to remove all my data from your system. That's totally fine too. So like there's a bunch of regulations outside of even HIPAA in terms of data and personal privacy.
Got it. And where do you see AI taking this business in the future? Like, how do you see it evolving in the next maybe 6 to 12 months? And impacting your business in any way, shape, or form?
Yeah, I mean, like a good example is right now, if I'm a doctor, I'm scrolling through online, I'll get banner ads for things that like I don't even prescribe. And I think the ability for AI to take all those data points that we have and make something that's really relevant to that doctor is like pretty tremendous, because there's just so much out there. And the advantage of AI is being able to put all that together cohesively in an easy way. So I think eventually we'll end up in a world where like, the right doctor is getting the right message about the right thing, and it's not spam, it's not unnecessary, it's not kind of the way that things are right now.
I think right now, based off of what I read and researched, you'd scaled almost to like 1,300 practices throughout the United States, or maybe more than that now at this point. How did you achieve that, and what strategies were effective in achieving that particular milestone? I mean, like that's amazing in itself.
We actually have access to about 800,000 physicians now, so it's like expanded way beyond that. And it's a mix of what I talked about, right? Build, buy, partner, where we've built a bunch of things in terms of getting people onto the network. We've bought companies that already had physicians that are part of them, and then we've partnered with companies as well that extend our reach. So like that's the simple way of doing it.
I don't know if you can reveal revenue numbers or anything like that, but like, can you give me an idea of like percentage year-over-year growth? What does that look like for Impiricus?
Yeah. It's high, like it's in the thousands of percents.
Wow.
Yeah, so we're moving very fast, yeah.
So like, I guess when you started year one, it was just you and I believe your co-founder, I forget his name off the top of my head. But like, what was year two like? How many employees did you jump into? And then year three, and then 4 and so on?
Yeah, well, one of the unique things about Impiricus is like we're really efficient as a company. So not to reveal too much in terms of numbers, but like right now we're about 50 people, and we're like definitely top quartile in terms of revenue and all that stuff. For the amount of people we have, we're profitable, we're cash flow positive. It's been good.
Have you ever had to get any sort of like funding for Impiricus itself? Have you been self-funded? Like, walk me through that a little bit.
For sure. So when we started in 2021, we got some funding just from friends and family. Then in 2022, we actually raised some venture funding, did a seed round with an institutional investor in Nashville, and then one based out of California. and then from them have just been profitable since then. And so we raised a small amount of money. I think it was like $3 million in 2022, and then since then haven't had to raise any more money.
Did COVID have an impact on this business at all, in your opinion?
We kind of started on the tailwinds of COVID, but definitely COVID, I think, accelerated the thesis that like the idea that all physicians want from pharma is a lunch, like that couldn't happen during COVID anymore. And so pharma had to get very creative in terms of, okay, how are we actually providing value? So it made our sales a little bit easier in the sense of, all right, here's other ways to provide value besides just giving a doctor a lunch.
And just for the audience's sake, what is a thesis? Like, what do you mean when you say thesis? What does that mean?
Like if you want to build something very big, you want to think about what the world will become 5 or 10 years from now, and what you're going to do to make that thing happen, or what role you're going to play in there. And that's kind of like a thesis, right? Like our thesis is that 5 to 10 years from now, pharmaceutical companies and reps will still be important, but they won't be delivering lunches anymore. What they'll be delivering instead is information, more patient-focused things. And so if that's the case, that's how we think the world is going to be 5 to 10 years from now, then what do we do on our side to own that space 5 to 10 years from now?
Has any particular experience throughout your practicing years impacted, I guess, stood out as a unique case or a unique inflection point for you in your entrepreneurial journey?
Yeah. Obviously, I mean, every day when I see a patient, you're obviously thinking about like things that could be helpful for them, things that couldn't be helpful for them. So like it happens all the time where I'll have a patient come into clinic, they'll have, a certain issue. Like literally the other day I had a patient who was doing very well on a drug and then suddenly got a bill that was like $10,000 and then stopped taking the drug. And then she saw me a year later, she was seeing a different provider, and she saw me for the first time a year later, and her skin was horrible, like things were going really, really bad. And so I was like, hey, everything was fine a year ago with this other doctor, what happened? She said, oh, I got this giant bill. And she said, I called the doctor's office and they didn't know what to do about it. And on my side, I understand kind of the pharma world. It's like, yeah, you need to contact the pharma company. They will actually be the ones that are able to take care of it. So stuff like that happens all the time, where there's a patient interaction or there's something that's happening where I could see, oh yeah, this is something that Impiricus can definitely help solve.
So have you had any sort of major setbacks, either in this business or in previous businesses, that maybe you would love to share with the audience? Because myself as a business owner, I've owned a couple businesses. I've faced so many setbacks, whether it was hiring employees or just mental hurdles of like, okay, how do I get this business to grow from, let's say, $1 million to $1.5 million, 2 million, whatever it is. Have you had any sort of mental struggles or pain points inside of businesses before that maybe you'd love to share?
Yeah, every day there's different struggles. Hiring is obviously a big piece, right? Like cultural fits, being able to make sure that someone is doing well, and then really objectively evaluating, are they actually accomplishing what you want them to accomplish, is a big thing. So that happens all the time. We've had contracts obviously fall through, right? Like when we raised our seed round, we had a huge multi-million-dollar contract that fell through kind of a few weeks after that, right? And luckily we have great investors, and we got through it, but that stuff happens all the time. I think the good news is, since I've been doing it so long, you kind of understand that like this is just the way it is. Like you'll have crazy highs, you'll have crazy lows, and that's just what it is, right? And you just kind of have to get through them.
It's the culmination of the highs and the lows that eventually make an experience, right?
Yeah.
So how do you maintain your, like a personal life, faith, business balance? Like, because you're telling me like, hey, you're coming in on the weekends, you're running this business, plus you're doing dermatology work on the side. How do you manage all of that, especially if you're married?
Yeah, no, I have a great wife. I have a 2.5-year-old son. My wife's expecting. It's one of those things where you can do anything, you just can't do everything all the time, all at once, right? So like to that point, my dermatology job is that 8 hours, and then after that 8 hours, like they can't contact me. And then like this Impiricus job is this, and they know that I'm available during these hours, and obviously I'm always available nights and weekends and have calls if it comes up. And the same thing with my wife. Like she knows that I'm available for these times, and like I'm gonna be fully present there for those times. I think the hard thing for people is like when they try to bleed it all together, and then you end up getting poor results from everything.
So when you say bleed it all together, what does that look like, or describe that?
If I'm at home at 5 p.m. and I'm thinking, and I'm not saying that I'm perfect at this, right? I do this too, but if I'm at home at 5 p.m., workday is done, and I'm supposed to be with my wife and kid, but instead I'm like scrolling through emails, and that's kind of their experience with me for that 4 hours that I'm at home with them before they go to sleep. Like that's a poor experience for them. It's also a poor experience for my work that I'm like I should get that done during the day, things like that.
So being efficient with your time, basically.
Yeah, efficient, but also being like very structured with it and like blocking things off.
What advice would you give to Muslim entrepreneurs who want to break into the healthcare or tech type like industries? Because this is a mixture of both healthcare and tech.
Yeah. You definitely like need a lot of experience in terms of like the easiest thing is like find a job in that area, like find a job in healthcare, and you'll probably see a whole bunch of inefficiencies that could spark an idea. The first thing you want to do is like find a real problem to solve, right? Like if you can find a real problem, then the rest is relatively simple. You just try to solve that problem. But I think a lot of people make a mistake of they think about a solution and they try to fit a problem into it. So like my advice is like find a job in healthcare, and the more ground level job it is, cleaning the floors, whatever it is, you'll find the bigger problems there are, and then find some problems and then go from there.
What kind of legacy do you want Impiricus to leave in the healthcare industry? And what kind of a personal impact would you like to make as an entrepreneur within Impiricus or even outside of it?
Yeah, I mean, Impiricus, alhamdulillah, has been doing very well, and like we're already making an impact in the industry. And I think for me, that vision of, okay, can we move away from pharma just delivering lunches to pharma delivering real value to patients has been really important. Like we've been able to show, hey, cancer patients have been able to get on therapies because we were able to help a doctor get access to a resource that matters to them. So that's like really, really big and really fun for us to do, but also really impactful. And then for me personally, I'm not really sure. I mean, we have an amazing team here that I think, this is the company that's going to kind of change their lives, both financially, but also from a reward standpoint. Like, every quarter we travel as an offsite we're going to the Dominican Republic later or early next year. And so like, that's going to be a fun time for them. We're solving real problems. We're helping each other grow. So like, that's been fun.
I am amazed. I am fascinated by the journey that you've had, because my story won't necessarily relate to yours, but hopefully for the audience, they'll be able to relate to your story, right? And I think that's really fascinating to a degree. If people want to find you, they want to message you or contact you, what are the best ways?
Yeah, the best is probably just LinkedIn, send a message. Definitely, if you're Muslim, say salam, and yeah, we can talk. Yeah, I'm always down to help people too, because when I was starting my first companies, like whether it was in high school or in college, it was really tough just to like find real advice and like someone legitimately to like tell you the truth of this is what it is and what it isn't, as well as give people confidence. So I'm always down to do that for people.
And in some cases, like for me, like when people reach out to me, I love giving them the practical, like actual applicable steps in order for them to move forward. Because sometimes what happens is like, it's sort of like the Healthcare Pharma Relationship that you mentioned, right? There's so much stuff, it's 10 layers deep, and you just want to bring it up to the forefront and it makes it easier, right? And
Exactly.
with AI, it even makes it faster, right? So it's like, I think that's what I love to do, and that's hopefully the intention of the pod itself. But I really do appreciate it, and thank you so much, Osama.
Yeah, for sure. Thanks for having me.
Absolutely.
All right. Assalamu alaikum.